Knowledge is power. In the past 12 years, the Center's Executive Council has hosted more than 25 educational programs for thousands of women who want to help make a difference.
Today, we're going to focus on the power of your genes.
So many other cancer genetic centers, they just test you and they send you out. And Judy was really a visionary when she developed this disease center because people are followed in our clinic over generations. We have 13 genetic counselors, and this is what we do day in, day out.
Please consider the following 3 personal takeaways. Number 1, learn about your family history.
The woman was tested at an outside facility, and she was found to have a CHEK2 mutation, and she came to us thinking, oh, I have a breast cancer gene. Maybe I'm going to be told I need to consider having bilateral mastectomies to reduce my risk. And she really wasn't sure. When we do genetic testing, sometimes we test for high-risk genes like the BRCA genes, but there are others, and CHEK2 is what we call a moderate risk gene. So it does affect one's chances for breast cancer, but not as much. And so with that knowledge, she completely changed her plans for what sorts of interventions she was going to consider.
Number 2, feel good about the progress being made in the research and treatment of women's cancers at the Susan F. Smith Center, right in our own community.
What we've learned is that one can do rigorous screening of people who have these mutations through something called whole body MRI. That screening can find a cancer early. People with Li-Fraumeni syndrome will actually live longer if they're screened in this way. So we have this available at Dana-Farber. It's obviously not covered by insurance, and we do use philanthropy to enable my patient, as well as her siblings who tested positive, access to this type of life-saving care and treatment.
By having genetic testing, I was able to make life-altering decisions thoughtfully and without haste, and most significantly, without a cancer diagnosis looming over me.
And finally, do your part.
We want to step on the accelerator. We want to push the science further, and we want to push the clinical and translational research further.
We as a group have accomplished much, but we never would have accomplished any of this if it wasn't for the vision, foresight, strength, and incredible dedication of Susan Smith. I know that we all share a responsibility to continue her important work.